This week, health minister so hun sensem bi ba kakra. And it's a PMO Tamale Teaching Hospital. Your videos be or I say bona moshe kakra. But if we as I mean Timmy Hwase anye juma ye and it's oko PMO hono na on tia se machines omode ye juma no ebi asese na asese so no omo ehwe hospital no so empanifo no na on tia se omuntu anamon bia se omo behwe na sa machines no yes sa machines no se enchechremu no amba ye ana emse ntubo ase so amba ye mentemi ho ase etini ho simu ewiye no even though omkodu ho anopa no edu enwumre no na CEO a ohwe Tamale Teaching Hospital so no na yeyi nedi emse asem no anye nkofo bebre de Tamale Teaching Hospital Doctors Association declare strike say emergency cases omo enhwe intino yenhwe health minister the CE ewo Tamale Teaching Hospital.
For sharp de ho sam so kwabena minti akando e de ato a doctor for a wonum
you are behaving in front of me. So you can imagine how I'm trying to explain. You can imagine how I'm trying to be
Osofo a ono na hwe apomuden ewonsem so kwabena minta akando e de atudwa se no krepa se Chief Executive Officer a wo Tamale Teaching Hospital Dr. Adom Kofi Ntempara wochira womo amane nkrata eye leta bi chese ne dwuma wo ye no womo agye fini nsem na bra nsentrofo ebisa osofo ise eyade a owura Adams agye eye nkrata na tuma wochirima ono de ontimi enkyere onim wochira enye de esi ye na no kwesi adane nkuto na emum empenifo etnas committee eye nhwehwemu na nhwehwemu ebeto odwa no ana womo ekyese enkyeye bia nipa bi atwa nananom ewo ensiedo ewo saa ayaresabia no nanu ana omanfo eka ho asempa oswafo edi tudwa se ehu behia pa so omanfo a doctor for na nurse for woma wom ye adwuma wa ayaresabia no enye odopa edema eye apomuden ewonsem enkankan se obi etwa nananom ewo nsiedo a osan edi tudwa se eni anye ho kura ewa ayaresabia no anamuntu a womo etuye efa akade esese womo ehwesu ye no.
That's why it's blown up.
No,
can you imagine if it was related to
you? Are not also understanding.
If you have that mindset, you will get the impression wrong.
You're not understanding me. It is not.
I told you to keep quiet.
Enkrata Ghana Medical Association for the abetu jano which mu se oswafo wo sharp omudin so kwabena menta akando enu ye bia ede die bra wo call Tamale Teaching Hospital wa kwansere ko wi ase kura no CEO a woda asoye ya no wapamono no entwayi ochemu se oni apomdi adwumayefo ho no e ka bom e pa kontabuo na wo sere nso se atete e free abaye adwumayefo ho na yeyie e wo se eto etwa no hu ne se ya wa yi CEO yi edi eyetumi bi ekura wo so afo sharp omudin so ena odedi dwuma ma natara so eno achi won krata enim no ochemu se wo pe bibi e friend media audit ya wo yare
tansem we mu no yenko phone no so na yenko phone lines no so yani Dr. Thomas Anaba or your ex CEO Rich Hospital Enkasa. Doc, good morning.
Thank you very much. Me Susu me to see me MP for Garu, Menya Rich Hospital ex CEO already. I am the MP for Garu constituency. So I think you should add that. Yeah.
Me pacho you. Where the facham why? I'm say MP no so mu nya pa.
No, I said hear me. It's a title I struggled for. So
yo me that see.
Say hear me because I struggled for.
Oh, hear me pa. Honorable, right. Honorable, the course week we mu no. Wadwen kire e wo ho ne sen your initial thought about the course no.
It is something that I think that it shouldn't have even happened. Because a father cannot be talking to their children, or an employer cannot be talking to his employees, even if it's wrong, for you to stand up to him in that manner. In our customs, it's not good. And I think you can bear with me. Let's put politics aside. If I owe a hospital and I have my staff and I come to ask of something and you think it's wrong, you just keep quiet and listen to me and find a nice time to come to me, to talk to me. But a broil ensued by exchanging of words to two ministers, which I think that it wasn't up, it wasn't good. It ended up with the dismissal of the CEO, which I don't think is strongly related to the dismissal. Perhaps there were other issues already pending before this broil took place. Because in front of the minister, staff of that CEO were challenging a minister, were arguing with a minister. He should have been the one even to ask the doctors to keep quiet. But he failed to do it. So to me, I think we have mixed up things. And the minister is a minister. In any case, he's the father of all of us who work under the health sector. No matter the size or whatever, he has been appointed by the president and needed some amount of respect. Even if it's erring, you have to find a nice way of getting him to understand it. And you may even win more favors from him than challenging him. That is my initial comment.
Doc, let me ask you this question. These are professionals within the hospital. And so
yes.
if the health minister is going there and right
yes.
in front of the health minister,
yes.
these leaders of the hospital are being made to look like irresponsible people. They know the issues within the hospital.
Good. Adom went to the port. There were professionals at the port. He went and shouted at them. Were they no professionals? Did they shout back at him? That is respect to seniors. Respect to your parents. Respect to your elders. He didn't shout. Watch the video very well. The minister was asking him questions. It is when the doctor said that you are hyping the death issue. That is when Suhini came in and his voice went high. That is when the real argument started. But if you watch the minister, he was talking, asking questions. He was not shouting. They were only the doctor was repeating his request, the sentences. But when Suhini, when they said that, oh, why are you hyping the issue of this death? That is when Suhini jumped in. For one death is too much. Even if it was not your fault, but you don't say it in the air. I know Tamale teaching very well. And I know there are several challenges because of the mismanagement by the management of the hospital. I know Tamale teaching hospital very well. And I understand the doctor's plight. They need equipment. They need consumables. And you can see the list they gave to the minister. If that is your hospital and you give this to a management to manage, and the office, a medical doctor will be asking for these simple consumables, except for the ventilators. The rest there, the management can buy. And they give it to you. That day, if you are the owner of the hospital, you remove the manager. Because it means that he's sleeping. When his colleagues in other hospitals are buying dialysis machines, are buying CT scan machines from their IGF, what do you expect a minister to do to somebody whose hospital is telling him that they don't even have common gloves and common disposable gowns to do surgeries? They don't have water to do surgeries. You do research a manager there, and on top of it, I come to see you, and there's an issue about a death, and the doctor is challenging me, and you, the CEO, you are standing and looking at him quietly.
Honorable, who justify the removal of the CEO, Anna?
I'm not justifying the removal because I'm not justifying any removal because the removal is justified. From what I'm telling you, I have managed hospitals, and I've worked in the health sector, and I've gone around to visit hospitals of the same caliber. Look, let me tell you, doctors in TTH, but for the confrontation with the medical doctor, would have held a party when the CEO was dismissed. But for that, I am telling you from the background, and you can go to the Facebook and other things and listen to people talk. But for that argument, they would have applauded the minister.
Doc,
so let's not mix the two. But the other issue I'm just perplexed is about the GMA. Some members of the GMA, I will not say all, some of the executives. When they sacked me at Rich Hospital, did GMA write any letter? They said, Atari, who sacked me from Rich Hospital without justification? It wasn't that somebody died and he came and they sacked me because somebody died. It was because they didn't just like me. GMA never came to my aid. They appear to have selective sympathy for people they like, even if they are incompetent.
Honorable, I'm bisa asasem we. Sanyoma we SSA koso. Uso ebi ato pain nkofobi ampe wa asem nti wo region ano mu yi ufi ho. Ye ko ye nimu no, ya sen ye yi Tamale Teaching Hospital CEO no so ye yi nedi. Sanyoma we eto ontwa. SSA eto ontwa. Ana wa dwen ni sen.
They didn't remove the Tamale Teaching Hospital medical CEO because of political issues. They came there to visit the hospital like he went to Rich Hospital. Oko visit Rich no wataki CEO no, medical director no. Rich, oko visit omo lucky toilets. Toilets are omo constructed just 8 years ago. Omo lucky toilets Rich Hospital no. Wasaki CEO no. Wasaki CEO no. So why do you say he has gone to the hospital and sacked a CEO? He has gone and witnessed something that he thinks that is grievous. That is the reason. So if you see that he went to Rich, even had a confrontation. He even called them to ask them why they are locking a toilet. And patients have to suffer to use toilet elsewhere. He didn't sack the CEO because the CEO comported himself when he was talking. He held himself. He knew that even if the minister was shouting at him, though he didn't shout, he had the right to do it. But he could find another way to converse with him. Did you see that they sacked him?
Honorable,
but he went to... No. But look, me, I sympathize with doctors. So, you know, I've never gone on strike and I've always fought for doctors. But in this case, don't fault the minister. Let's use our tradition, our culture to do the right thing. You can't shout at a minister. You can't. You can't.
Honorable, my final question here. Recommendations be saying.
My recommendation is that I'll appeal to the doctors to rescind their decision of forcing a minister to apologize to them. Because let me tell you, the minister controls the whole health sector. The best thing they could have done was to use that platform of the visit and the challenge that they had in saving that patient to negotiate with the minister to even get more favors. They could have used it as a form to negotiate with the minister. They could have gotten a boost of supply to the place like they have achieved. But to argue with him and tell him that he must come and apologize. So you come and apologize. Tomorrow you want to go and do residency and your name gets to his table. Tomorrow you want to go and for international conference and you want that minister to approve for you who stands before him and shout at him. You see, elders are elders. However an elder makes a mistake, you find a gentle way of at least calling his attention. And if you call his attention in a gentle way, you can even win more favors. But for even though that's okay, the minister has still supplied them with all the lists they gave to him. Haven't they benefited something from it?
You honorable, you better was
you
any wajin child eba same so. Dr. Thomas Anaba, ex-CEO of the Rich Hospital, or say or ye honorable or fighting for or say Brian Sena or be MP for Garu. Mama in friend just say or ye ex-CEO. Lawyer my member also so same way. Watch your videos you know. A situation resulting in doctors withdrawing almost services, especially emergency services, or Tamale Teaching Hospital, or in solidarity with the sacking of the ex-CEO. Why don't you anything?
Yeah, me that's it. Just here, Daniel Kupas say at the end of the day, the revered chief. Yana.
Yes.
Adom. Yana Abim.
Almost say partially normal withdrawal.
Yeah, partially normal resume.
Sorry, partially normal resume services.
Services no. I didn't know. Oshima minister on the visit was not announced.
Yes.
It was not announced. It was a surprise because me sure says the minister no be call no man. What still near maybe in same be what I was so on all person or say I am partner. Now me sure say same what it the immediate one was video I cover say Sebi Nipano Efimu and then there was no much and I deserve attention from say doctors and nurses no. If they are doing their best, put me home. If they are not doing their best, they are casual about it. And so put me home. And then I can say sometimes perception about what they do. And maybe if you're not able to communicate to the people, process in your mind. Now, maybe it's different from what your professional advice and opinion would be. And me sure say because Okoye na we so ko share kasa bi ba I agree say Sebi ebasa una oye penny wo ehonum. Even if the minister thought anani ote might not be the truth or full proof you needed patience to talk to the minister and tell him maybe after a moko round why you didn't only na kasa say this is it maybe near catcher near ote but the fact was omoko equipment in na assay. So what has kept you for all this while? Maybe report na uncle do minister no or you've not been able to put your initiative I say manage hospital no. You're using your own initiative IGF I think that it wasn't right for them at least shouting in Yama. But it also tells us like Dr. Nabaka, member of parliament for Garu. Okay, I say Nyamibiba, I say Nnawotwe. Patience is a virtue. The fruit of patience, it's sweet. I say Nnawotwe. Because public administration, it is difficult. Governance is difficult. Bontia, and out me who say but I think that it is far too many times in previous government, even this government, we are seeing people are being sacked or grassroots economy pulling them. Also, the standard of precedents that are being set, if there is some slight difference in it, then people have cause to worry. What I said, Dr. Nabaka said, when even the minister went to reach, now maybe cause also
to toilet.
Yes, but me sure say at the end of the day, chief executive want to make a why the reasons because they say a rational person will not lock the hospital for the toilet for anything. There might be some reason or some incident may have happened. And maybe or not so fast, I think that any GMA to say or kind of say the selective approach, say all those times GMA was not able to issue and say that this is not right. This is
when he was being
attacked.
attacked.
He was being attacked. Yes, the past is gone. Let's move forward. Let's find a way how our hospitals are. I say one of the biggest problem chief executives they are finding it difficult. Maybe is this about our procurement issues. Also, procurement, you have to go through a process. A process I will be cut through.
Bureaucracy,
bureaucracy. Now, bureaucracy, so does you don't have the power to say. As chief executive, maybe want to mentor BBA, it's over 50 million and now 10 million, 1 million. Want to mentor unless you go through a process. Now, that process you have to go through. Also, a 30 beer, you have to buy them in dollar. Of course, supply we or say on farm when so because on him say, auto a public institution, auto for almost a year you are not going to pay. Until they are going to inflate the price for you. And there may be a ton of 5,000. No, they may be giving you to about 20,000 because Omuni say that whole 1 year no, and so they peg the money projection, and it is one of the difficulties the chief executive. And I think it is time we sit around the procurement issues, so that we can give free hands because Obianim said we turn 50 cedis. Shopper. There is no way, sir, 50 cedis, you give the chief executive also that shop way. And also, the only thing he can add is transport and installation. But if you don't give him that, now the same store, he will pay in a year 50 cedis, near the mile 200. Those are some of the teething problems.
Okay.
We need. But I think that so far, the health minister is also the authority there. On the this thing over there, the head over there. I think that out of all this one, yes, is a learning curve. Okay. Sometimes when some of your subordinates who share or more, everybody like a man, you have ego. But let's approach them. And I think at the time he was okay with them until the situation happened. Let's all of us learn from it. Okay. It can happen to anybody anytime. Okay. But I'm happy. Now, Yana, we are grateful for your intervention.
Sedu, wahwe the course no. Ebise ntwaye ewe no CEO no yapam no. Na kwanso anu no ana.
Yo, ne edi kan ma memfa akwanya we na memma abusuafo a omo ahwere omo de hye yakọ. Se ya ohwere wo de hye ya pa enkawa na wonim ekawa obehu se na ete. Nti ya ma abusua na yakọ. Se enye boapayo se we yesi. Na mum esi nti yakọ kese pa enko emomo. Na ni esi o Tamale Teaching Hospital and nano Sunday there. Mijidi say it was avoidable. There in the first place and say esi nka due diligence be juma nka this is an avoidable incident. And entwe ye esan say minister no echo with a certain intent. At the end of the day, intention or the call no. It may be right, it may be good. Nemum, it was tainted with the incident just happened. So, baby, we should have been discussing the real issues that the minister went there to identify, but for this unfortunate incident. Tinamika said the incident was unnecessary, it was reckless, it was unfortunate. Okay, say it's discretion be, yes, as I say, due discretion be nka ANC. Na Doctor now we interview no mete ne kasa. Wa kasa ye na mum mahu se o hwɛ the tone of the language. Utimu se ye nua no mo NDC for there. Vengeance na ewo mutrim. O study the tone of the language papa na o kasa obedru baby no say na ono you no fi your friend say Ridge Hospital no GMA betro letter. So you see this kind of demeanor. It tells you say okay, there you be nti yeso ya nya tumi nti emfanya omo. It is wrong. And yes na nka wo say Osan so ka say a minister is a minister. Enti chese under wo mo de minister kasa obia enkebi. Mijiri ye say enye sa na ete. Mpenyimfo ebu bebi say openyi odue mante. Minister no oyo penyi obia ajetum say our supervisory role over that sector obia ne no emumu hyew ono na ye openyi no but openyi odue mante utifie na enkola edi agro na hu say enkoye kura ebi wo ho na wa yedi omu a na wa from say kwame ni awoye yeyi wa anye ni ye kofi ni awoye yeyi wa anye ni ye Minister no call her and no kuhu nema we are. what stops him say or yet ne observation ne or taking a stock we are see you on one inviting about office one crime on to me nka so wamba odimirika pa that day no me sure say flight the last flight na water Tamale kra no e no de beba e san say openi ato ne safra adan e na minister no antimi anya na sa e san say me a minister me kasa obi anka bi until let me confront him. And naturally, send a senior man, every man has an ego. Yes, you will be. And the last thing of a man that you attempt is his ego. You can take everything away from a man, but don't try that thing. Or the beshia, or boss baha and now giddy you react the same way. Prima facie, you react the same way. Tonight, said the minister should have exercised some discretion. Say yes. Ushe Tamale Teaching Hospital. The whole region, the northern region in a whole, is one of the under-resourced regions. And it's a fact. You can't deny that. And within the northern region is the Tamale Teaching Hospital. Meaning Tamale Teaching Hospital. There are issues. The doctors there work under certain constraints. The work under some difficult conditions. In some way, ABC, we need to get a certain sober reflection. Let's listen to the people. This open confrontation, trying to show Obia say, "Me na me minister and I'm a kasa Obi Nkedi." There be yes, we are minister. For all you know, Papa na onene kasano. He has been on this job for God knows how long. Yes, we are minister. Watch idea. After 4 years, Obeko. 2028, you better be after 4 years, Obeko. Now, Obi. All year, Juma, over 10 years. Now, and then, what be the minister? Ope say, Yefro Kanta. Ope say, Obi, who say, and then, I'm a minister. Me can't move being kedi. Enjoy in ka minister no, a karen who ya. Me jidi say, ne, baby, ayeti. Wouldn't be discussing the confrontation. We would have been discussing issues that will ensure that Tamale Teaching Hospital, the under-resourcedness of the Tamale Teaching Hospital is resolved. Enyema eniho akadea omodebe ejuma eniho no. Nka no ho asem na ye be kan ne.
Mame ntwa no kakra the phone lines na be to screens no so intino sa opese we contribute to the program na wafre na mum no fresh so a pacho mentie wo ho ewo TV no so reduce volume no ewo TV no so na de opese wo ka no na waka ya power chow so se ma okasa a obeka no ma eho enti yempe ayesem bia enti enche bia no ya the phone lines na be two screens no so na mo to me afre na ma contribute yeah
na ne ya ene se me nuapanyi Alhassan Sohoyene honorable MP anya hwe kora no wo ofi mantem ho na nka wo se wona nka wo ye peacemaker I unfortunately ono nso adjoin ni nua minister na kasa na ye den kosoro ka megide se nka wo afi ho yi a one ne na nam yi de ne buafu a kosoro no wona nka wo se wotia ne nanso se ominia wo de nya abotre na ye ne nkrofo we enkasa kukuo mu na bebi a iye wo se ye de beto no na de ato ho
okay
ono nso anya ne sa ono nso de sa buga style ya ye de mu yi e de ne namu a
mame mobile phone lines na ema ya hwefo o mama person for 0302 211 701 0302 211 701 to 4 obetumi aye 1 no obetumi aye 2 obetumi aye 3 and obetumi aye 4. Hello Francis.
Yeah.
Hello Francis, Pacho Frefi.
Frefi Kantamanso.
Pacho, why you nche?
My drink can say no quality Bab me say oh Proverbs 15:1. O se kasaboko is sanka ebufu. Enti ya be minister na say no quality nyama nkoye eje wo. Nso say ya comporte ya ona say me ya doctors only to me diffo. On your professionals. Iti the Nebukubia, no Yame Casa, Sababu me Chasiano. Oh, Proverbs 15:1. Casa Buko, the Sanka Bufu, and my name not to ye. Jebez say, I have Kubia, Nnawotwe, na Senebea, never to ye, na Uncle Bufuna. I don't know, as soon as you look one, since Saturday woman. Oh, of course, right here, a patient woman. If you obey and sa, and she said, Minister, when you look at Sina said, if you were Giorgio, Nani may now to ye, the Darcy.
You hear Darcy. Nana Bonsu.
Hello?
Hello, Nana Bonsu.
Hey, I know I'm here.
But I know humanity TV. And your humanity TV. And then while I know the TV.
Hey, Orlando.
Walanyo.
Who do you know? But I established your friend or this about neighbors you.
Ma, me and you are doing.
Honorable International Chairman, as a teacher board and national organizer, now Fortuna Stream, just could be a maintain. Kakra makers and a 2 million cow. Then you know, Kanda, the Canasa Panama position, Sharon didn't come more. And to say a 12 hour, only Ghana for Yana, Juma, about the court, about the bar. It will be a consider what was a shell, Yamel was doing a share, and yet is the so better than 3 hours. And you know, an appointment. The appointment to Kwana and you a dear ward, you know, a so Ghana for me. At the moment, I say, you see, and Fiji and send some of the same thing. Women come home, no man, I'm to be best up to the power. I'm talking about that. And I'm at Medasi.
Yo, yeah, that's it. Ben, what's your name? Hello, Ben.
Hello.
Hello, Ben. Hello, Ben. Okay, Mr. Ben Ahumano. Mr. Atiko. Share program here na Nnawotwe program na share no. Ubetumi afre na wachre wadwen e won nsem a yedi ho enkomo anope. Enti numbers no na egu screens no so no. 2 p.m.
Minia.
Bacho frefin.
Bacho 2 p.m. Kasa free Asante Mampong.
Yo mienti wadwen che.
Mame mo about no juma pa odi pa why.
Medasi.
Na menchi Kumasi kie me mayor. Honorable King Zuba on this original chairman na kwesi. Minia, yebesere. She aban ko aban ba. Sa na ma we say yebeja ya Ghana for na beboa yo. Emre bi obi ye bibi. Ba obi su ye bia. Na ese akwa dane topic kese. She say yansesan free sa ye niema bone ne sa ye niema na ye ho a. Ye my Ghana no, minia sa na betra wo sa aban bi ba na wutu no fo e bia yenye bibi say because of say the party abanti die. A favor the party for Nkwa, Yabesre Ghana, ye nyini kwa chiri, ye usia, se nipa na betimi ya adwuma ye manenye, ni nya say, politics, party A, party B, se jai say na mana, ebama ye kuro Ghana, atum pompa, kajagu mami 2 p.m. ampon, makrao.
You there say 2 p.m. on a Friday. Also betimi afre na wachre wadwen. We are Nnawotwe adwuma. Hello, Kwaku. Oh, Kwaku, where the Kafra? Kwaku Ahumana. Kwaku Ahumano so, and I say,
that's what I'm so.
You Kwaku Frefi?
A phrase of the Kuma.
You ain't your drink chair.
Okay, Mate. And by time, Wahumanaso.
Wahumanaso.
I'm a phrase of the Kuma.
You, you,
yo, Madame Mastipai war, and Common Moody and President Chairman and Kakai. You, I'm Wahumanaso. Okay, Mate. Na me super me chema je kakra won komo na mudi no ho e pa se mo ye djuma dia boa o my Ghana na me so ma je nche kakra ni se this time no wo hwe senior politicians no react towards young people for na otumu se aka kakra because obu ono ma esan political appointment bi nti no ni di a esan ko de ma pani bi a wo ni mu no ya na omotutu sa ni di na se Indiana President Chairman said, Yambo modern. Na yemfa ni di efata, emfa ma yempeni for despite opposition and political party being in win and intino. Yambo modern yen coaches adiano, ever yam ranch and maba and maba one about this time. So I quite to say this time no ni di I demand yempeni for no esotia net and MY was yempeni for or with the kind IBB and I younger yefi echi aban year 2 years so. Nti se yamfa ni di ama yempeni for na ebe ma won a wɔn nso ɛreba no wɔahwɛ a wɔn nso mɛfa saa anamotuo no na wɔn a sisi ano wɔn di tumi no wɔn aka ɛreba de tie nso ɛde the same thing ɛba bɛyɛ wɔn anim no ɛmmoa yɛn asɔman ntɛm nso madwene kyɛ kakra no sɛ sɛ nyame adom yɛ position yɛn ho ɛwɔ political appointment bi a yɛn bɔ mmɔden na sɛ mpanyinfoɔ na wɔn yɛ anim no ɛda yɛ position ɛwɔ soro sɛ wɔn deɛ no kora mpo na yɛn bɔ mmɔden yɛn fa ne deɛ fata no yɛn fa ma wɔn ɛfa minister health ne ɛne CEO ne issue ɔyɛ panin CEO no ɔyɛ panin nti minister wɔtumi afa kwan bi so na wɔtumi ɛna kasa na ɛtumi agye aso.
mɛpatwɛ da se yo hello Rita.
But the minister ne yɛ no so bi awɔ ɛkyɛ sɛ Ghana has to health center as a health show there in fact ɛkɔm si treat nipa no nti ɔmo de ɔmo no ma go so mo nya adwuma kɔfɔ si so mo nya adwuma yɛn fɛ no mo kɔnkɔ yɛ adwuma but medasi
yo Mr. Medasi in 1 minute lawyer wrap it up in 1 minute now just wrap up and then on all the issues we've discussed just in 1 minute.
Constitutional provision my Chief Justice no. I have great faith in the committee. The committee no akukunda for so, and I'm sure say they will do the right thing. Emrano look at the exhibits and evidence. Inti yeni na yenya botre na Emrano enosun yedi. Na yehun so say, and I can assure the Chief Justice that she will have that fair hearing. Any because it is supposed to be in camera. At the end of the day, everybody will be happy and see the position that will come. 2, I think that Abawo Health Minister Nenyama Weisono. I think that we have learnt our lessons. At the core of it now, Obia Air Kano is Ubu.
Okay.
Respect for each other. Ubu Obia is reciprocal.
Mate.
Yo, I'm saying na migumasa muso ansana callers na start even to 30 seconds account there come. Ohwe bibi a minister no ene ne omokoye bibi a ekodu ye na yehwehwe se eye boapayo bi na omode eye ye. Ohwe a and bibi a na omo issue letter say omo afa mo si na omo ko appoint NDC ni say program. It tells you say eye orchestrated planner omode esiso. Why am I